I'm sorry, I was not audible. So, welcome to the session again. I'm Dr. Anupama and wish you a very happy new year. So, today, in most part of India, we are celebrating New Year. So, please take your time and write your name as well as country you're from in the live chat. We'll be starting a session in 10 minutes by the time everyone would join the session. Hello, Aparna. You're from India. So, are you a nurse? And I can see Ajit Jose, Susama Rajan, or Presi Ajoy. Hello, Sarika from India. Hello, Susama Rajan. Hello, Asanwa Nikam. If you can hear me, please type yes in the live chat. If I'm audible, please type yes in the live chat. Hello, Divya. So let me tell you again what today's session is about. It is a step-by-step writing class. So we had shared a task about Adam Smith in our Telegram group, and we'll be sharing it again in today's session as well. So we'll be learning how to write a letter in a step-by-step format. So before that, before we move to today's writing task, I want to know what are the major difficult areas in OET writing for you so that we'll be able to come up with sessions which would help you to tackle those difficulties. You can type it in the live chat. Hello, Mamta. Hello, Swati. Hello, Shan. Well, thank you that I'm audible today. So we'll definitely be dealing with step-by-step writing. Apart from that, what is the major concern that you have about OET's writing? Some people might have difficulties in understanding the task, while for some it is all about organizing. For some, it is the language, which is the unbreakable or the biggest hurdle for them. Hello, Simi Joseph. So Abarna, Papu, tenses, I think the verb tense, that is a present tense, past tense, and the future tense, that is difficult for Abarna. Yes, we will definitely be having sessions on different tenses. Rather than having a long one, we would try to split it up into different sessions because if you learn all the tenses together in one session, it can be quite confusing. So definitely, we'll take a note of it and we will be having sessions on the different tense forms. Hello, Chioma Mirabel, all the way from Nigeria. Limia, hi Limia. So your problem is in organizing. Arun Alex Matthew has problem in purpose and organization. Yeah, again, purpose and organization, a little bit of which will be taught today. We'll be looking at how to identify the purpose in today's session, and also there will be a little bit of organizing. We'll be having a more detailed one about purpose and organization if you would like to. So we'll just wait for 5 more minutes so that others also join. Exactly at 9:05, we will start with our sessions. So Sarika also have purpose. So I can see that many people have problem with purpose and organization. And yes, tense form is a lot of people's lot of people have problem with the tense form. Connectors and article. Yes, that's right. Hello, Liji. Divya also has problem with purpose and organization. So before moving to that, I want to know like how many of you had written the letter already about Adam Smith and COVID-19 case. So Abarna Bappu also face a problem in writing in a concise manner, and you end up repeating the same points. Okay, yeah, repeating the same points. We'll have a look at that as well, because when you repeat it, one thing is that you lose conciseness and your word count becomes high, and also sometimes we may not get the word count limit to include other relevant information because you have already repeated the information, so that will just take up all the word count limit, and you won't be able to add on other relevant information. Yeah, so most of you have written Nosy Gray, who I hope I have pronounced your name correctly. So you have problem in introduction and organization. Yes, we will be having a session. Today we'll be having a lot of very live activities also. During the task, we'll try to write a few of introductions as well. Okay. So Mary, Vibinu, Susama, Sarika, everyone has written the letters. Prajesh also wrote the letter. Okay, Chioma, you couldn't submit it because of the timeline. That's okay. You can still submit it. Today, at present, we are looking at the step-by-step writing. So don't worry, you can still submit your letter. We'll have a look into your letter, Chioma. Yes, we'll try to correct the letters of the people whose letter was not corrected last time. So we'll try to make sure that most of the people get benefit out of this session. So some of you might already be a part of our writing group that is in the Telegram. Some of you might have been only here through the YouTube. So at the end, we'll be giving you a template as well. So please wait till the end and watch the session till the end. And Neetu, yeah, we'll give direction for your letters as well. So I think most of you have joined the session and we can start with today's writing correction. So this is a step-by-step writing correction, writing class, wherein I'll be showing you how to select, how to analyze, and how to transform the selected information. So before moving to it, would like to introduce our writing service called OET Write Smart, which is a premium writing correction service, and it includes unlimited writing corrections, tutor support, and writing and grammar live classes. It also includes weekly mock tests with a detailed feedback with grade for all the weekly mock tests and a weekly progress report. And as you all know, we'll be providing you support through our Telegram support group. So this was the task that we had presented to you, and it was made by Odin English. So we'll be looking at how to write a letter to this task step by step. We'll be going step by step for this task. So those who haven't got this task, this is the time you can take a screenshot or a snap of the screen. So this is the task that we are going to write today, step by step. I hope you can see the screen. If you can see the screen, please type yes. So can you see the screen and the letter? the writing task on the screen? If you can, please type yes on the live chat. Okay. So let's move forward to the step-by-step method of writing. So you might have seen, a few of might have attended our first session about writing classes. So I'll just revise it or go through it once more for the new ones and also for the old ones just to brush it up. So these are our mantra. This is our mantra to write a grade B worthy OET letter. So if you try to follow this and implement it correctly, you can get a B grade mostly. So try to follow this technique. And the ones who have not subscribed to our YouTube, please do subscribe now. Press on the red button called subscribe now. And also do not forget to activate the bell icon there, because if you do that, you will be notified every time we conduct a live session or any other recorded video that we publish on YouTube. So subscribe now and also activate the notification. So first thing that we would like to tell you is that we have to picturize the patient's story. You might be a nurse or you might be a doctor or you can be some other health professional as well. So first thing you have to do is that you have to imagine yourself as that nurse or that healthcare professional and visualize the patient's story. So for the people who have already written the letter or at least have analyzed the task, would be knowing the patient's story right now. So let's have a quick look at the patient's story. So the ones who have not gone through it, you can have a quick look at the writing task once more to have a look at the patient's story. So let me show you the visualized pattern of the patient's story. So can you relate to this? So you can see here, can you tell me what this patient's story is quickly in the live chat? Can you understand the patient's story from this picture? So you can see that there's a patient, so he's been to Italy, he's had a flight, and maybe he saw a doctor or was screened in the airport. Then he's at home, then he had fever and sore throat. He called a nurse and went to the hospital in an ambulance. He had some x-ray and some tests. He had some problem with his lungs, that is, he has bilateral pneumonia. He was given oxygen and medicine. And you can see that all the protective PPE has been worn by all the staff, and these are his primary contacts. So visualize the story. This will definitely help you to write a very organized letter. So the first step is to put yourself in the shoes of that particular writer, the nurse, the doctor, or some other healthcare professional, the role of the writer. Then you will be able to visualize the patient's story. And once you visualize the story, it is very, very easy to write. So visualizing the story is one of the biggest things. Next, we'll see what is the next step in writing. So you have seen Astra, which we had introduced in our earlier session. And this includes analyze, select, transform, review, and amend. These are the 5 steps included in Astra, or the 5 steps for writing a letter. A for analyze, S for select, T for transform, R for review, and A for amend. So if you follow these techniques and if you do it correctly, then you would be able to write your letter, a beautiful OET letter, in 45 minutes. So first I told you that you have to analyze. So when you're analyzing, it is very, very important that you identify the task and the purpose accurately. You can see on the screen three animals, three very cute animals. They are something particular about these three animals. They are from the same family, the cat family. So one is a tiger, one is a cat, and one is a cute looking leopard. So the OET tasks are also not very different from this. You can see that sometimes the purpose of the letter is confusing. You might look similar to each other. You might get confused, but it is very, very important that you identify it accurately. In today's letter also, when I have scrolled through your letters, which was posted in our Telegram group, I could see that some of you have identified the task and the purpose accurately, but some have gone wrong. This is exactly the area you should concentrate on. If you're asked to write about a cat, you should write about a cat. You should not write about a tiger. At the same time, if you're being asked to write about a tiger, you should write about a tiger. Even if you write about a, a tiger in an average language, that would be okay. But instead of writing about a tiger, you wrote about a cat in a very beautiful language, and you won't get the score because you were asked to write about tiger. This applies to OET also. So when you are asked to write about a particular thing, you should write about that. So you should be able to identify the purpose accurately. That is one of the first steps. So let's see what are the things that we should analyze. The analyze includes looking at and identifying 4 areas. First area is patient. The name of the patient, and the age or date of birth, the gender, and most importantly, the main issue of the patient. What is the patient's main issue? This sometimes might be difficult because the patient may have multiple issues. So you'll have to look at what is the main issue that is of concern to that particular recipient. So identify the main issue which is of relevance to that particular writer and the recipient. Next is look at the recipient. In the recipient, you should look at not just the recipient's name. Well, name is important in the address part, but most importantly, look at that recipient's or the reader's designation and the role. What will he or she will be doing for the patient? What will his or her role will be in the patient's care or treatment after you write this letter to him or her? So look at that person's role in the patient's care. Second thing that you have to look at is any existing relationship. Whether there is any existing relationship with the patient or whether there is any existing relationship with the writer. This is important. So you have analyzed 2 people now, patient and recipient. Now the next 2 things are writer and task. So what are the things that you should look for in the writer? Yes, you are the person who is going to write the letter, but you will be keeping away your individuality away. You are writing as that nurse or that doctor or any other healthcare professional who was taking care of this patient until now. So you have to identify what was your role in the patient's care or patient's treatment till now. So you might be a nurse at the hospital, you might be a district health nurse, or you might be a nurse at the ICU, or anything. It can be any kind of role. So you have to first identify this role. In today's task also, you can see that there are 2 different nurses included in the task, but you have to identify who you are. Are you the district health nurse or are you the nurse in the hospital? So identify your role as well. The task. In the task, you have to look at the type of letter, whether it is a transfer letter, a referral letter, information letter, discharge letter. So you have to first identify the type of letter, then most importantly, identify why you are writing. That is the purpose of writing this letter. Purpose means what do you want the reader to do? So write the purpose of the letter and include the urgency level. It may not be there in all the tasks, but if the task asks for urgent evaluation or urgent treatment, it's very, very important that you add this. In certain tasks, for example, if it's about a service, which includes visit to certain center or home visit, you may have to include Frequency and duration, for example, physiotherapy, hydrotherapy visits, or home visits by a nurse. You may have to include the frequency and duration, like daily, twice daily, weekly, twice weekly, and for 10 days, 1 month, etc. So these are the things that you look at in analyzing. You will analyze these things. You look at the patient, you look at the recipient, you look at the writer, and you look at the task. So here, I want you to write down these 4 areas. That is the writer, the patient, the recipient, and the task. And you can write it down in the live chat, and I'll be giving you 5 minutes for that. And we have a timer as well. So your time starts now. We'll start now. Let me just rewind it and tell you these are the 4 areas that you have to add in the live chat. Patient, patient's name and main issue, recipient's designation and any existing relationship, writer's role till now, task, type of letter, purpose. These are the things that you have to write in the live chat. So your time starts now. So I can see a lot of answers in the live chat. Mm, Patient's name is Adam Smith. No existing relationship. Diagnosis COVID-19. Purpose notified. So there are many answers coming up. So I think you need not even, you didn't need 5 minutes. So let's see what the answers are. You can just compare your answers with what's there on the screen. So let's check your answers. Compare your answers with what's there on the screen. So the patient is Mr. Adam Smith, whose age is 48 years. He's an architect. He's a frequent traveler with projects across the globe, and he reached Melbourne after a visit to Italy. The main issue of the patient is bilateral pneumonia, and he has positive COVID-19 test. So we can say that his diagnosis is COVID-19 with bilateral lobar pneumonia. The recipient is the Director of Health Department, Melbourne. The writer is the head nurse of isolation ward of Prince Charles Hospital, Melbourne. And the task is to outline the patient's history and to notify the primary contacts of the patient. So let me just tell that once again. The patient is Adam Smith, who is an architect and a frequent traveler. His main issue is COVID-19 with bilateral lobar pneumonia. The writer is head nurse of the isolation ward. The recipient is the Director of Health Department, Melbourne, and the task is to outline the patient's history and to notify the primary contacts of the patient. So most of you are correct here. So first we analyze the task. Now the second step is to start selecting the information. So your selecting the information will depend upon the reader as well as the purpose. So depending upon the reader and the recipient, and we'll be categorizing the information in the case note into the following. So key information. Key information is the most relevant information. This is to be included. And you have to remember that it always depends upon the recipient as well as the purpose. So most relevant information are the key information. Then there might be semi-relevant information, which is not as important or most important, but they might have some relevance. Then there might be certain information that is repeated in the case note. That may be relevant or may not be. So it depends again on the purpose. Just because the information is repeated, it doesn't mean that you have to include that in your letter. You have to include it only if it is relevant for that reader, even if it is repeated multiple times. If it's repeated multiple times and it is relevant as well, again, you don't have to repeat that information in your letter many times. You just have to include and highlight it as much needed. Do not have to repeat the information, relevant information. Even if it is relevant, you don't have to repeat it in your task or in your letter. Then I have also included irrelevant information. Now, irrelevant information will be there in your case note, but you don't have to include it because that is of no use to the recipient. That has no relationship with the recipient or the kind of care the recipient is going to give it. So if you think that there is some information which will not help the recipient to give the care, then you can avoid it. I've also added one pink box here called recommendation. It is part of the relevant information itself, most relevant information. I have added that tab because in the today's session, I'll be writing it as a separate thing so that you'll be able to correctly include it as a recommendation in your letter. So the most important type of information are called key information, then there is semi-relevant information, then there are repeated information which can be included or not depending upon the relevance, and irrelevant information will also be there. So key information, what do you mean by key information? So key information can be of two. It can be the information which are needed to understand the case or understand the patient and the patient's main issue and the treatment given to that issue. And the second set of information are the information that are required for the reader to provide the requested care. So to understand the case, let's see what are the information that would be needed for the reader or the recipient to understand the case. You will have to include the patient's relevant medical and social history, the patient's main issues, and the treatment or management that was given until then, and the patient's current status. To provide the requested care, you will have to include the patient's needs and what are the treatment or care or support service needed. And you can also include any factors that can affect or influence these. So let's have a look at key information. They are the information that are needed to understand the case and the information needed to provide the requested care. So let's see again. So the most relevant or key information are to be added. You can see a green tick there. And semi-relevant information and repeated information may be added or it can be avoided depending upon the relevance, and irrelevant information are to be avoided. So we'll move on to selecting. So just like you had done the analyzing part, now we'll have a live session, live activity of selecting the information depending upon the purpose and the recipient. You have already analyzed the patient. You've already understood what the recipient is, what the purpose is. Now let's have a look at selecting. So you will be given a timer again, and we'll have 10 minutes to select the information, and your time starts now. So select the information, select it as the most relevant information as well as the recommendations needed. You don't have to write it as the repeated information and the semi-relevant, but write it as the main most relevant information and what are the recommendations for the patient. You can type it in the live chat. You can write down the relevant information. What are the patient's problems? What are the main issues? And what are the treatment provided? And you can write as the recommendations. What are the recommendations that has to be done by the Director of Health Department? Please start writing in the live chat. So write down in the live chat what are the main issues and the treatment provided for the patient and any other information that should be known, and also write down the recommendations. I can see Limia writing. Name, age, frequent traveler, lives in Melbourne, date, symptoms. Complaints of the patient, diagnosis. Yeah, so right, what is the diagnosis and what are the symptoms and what did you do for that symptoms? You know, when you write down these things, then it will be easy for you to transform it. First thing in any writing correction or writing letter, you have to analyze it and then you'll start selecting. Write it down. Write down a list of information that you have selected. And then once you have selected and noted it down, then start transforming, then start writing your letter. Then there are very few chances that you miss out an important information. If you directly write it down from your task, there are chances that you miss certain information. Travel history, Prajesh says travel history, social background, hospital history like admission via ambulance, diagnosis, isolation, need of notification of the primary contact by health department. Yes, Prajesh. Susama Rajam says frequent traveler, recently traveled Italy, home isolation, symptoms started, self-treated with paracetamol. Divya says had paracetamol. Yeah. And Rajiv PR says he's a recent traveler, isolation, signs and symptoms, notification to health department, admission, treatment received, transfer to other facility, notification of primary contact. Well, some of it are right, but there is one incorrect information there. Robbie Bose says recount, oxygen, informed DHN, shifted to hospital. Aberna says architect travel around the world for project recently returned from Italy to Melbourne. Screening at airport, home isolation. Yeah. Any irrelevant information which you think that need not be included? You have to always remember the purpose. Is this director of health nurse going to provide care to the patient, or is his purpose something else, his or her? So this director of health nurse has a purpose. His purpose is to notify the potential primary contacts. So you can add all the information needed for that purpose. You can avoid certain details of the treatment required if you want to, because he's not going to treat the patient. The patient is still under your care. He's not discharged. This is also somewhat different from the usual task. Usually in OET or the practice materials that you have got, you might have seen that the patient is discharged, but this patient is not discharged. You have to look at that also, because there are certain tasks in which you might have seen that the patient will be discharged on particular date, or the patient will be discharged after 5 days. So it's very important that you identify whether the patient is still under your care or whether the patient has been discharged. So Limia, I think, says that children are irrelevant, hypertensive. Divya says two children are irrelevant. Limia says hypertensive, GRD, and OTC drugs are irrelevant. Okay. And avoid supplement oxygen. Yeah, you don't have to go into details. You can just add how the treatment was done. So we have a few more minutes left so that others can also type in, and then We'll compare your answers to the answers that we have already have with us. Simi Joseph says the relevant information are name, age, diagnosis, travel history, date of symptoms started, isolation, precautions to avoid close contact, need of intimation of primary contact, family information, job, traveling symptoms, etc. Detailed investigations. Are, are those to be included or to be avoided, Limia? Yeah, Olachi Okachukwu, this is not a transfer letter. This is type of an information letter. The patient is not being transferred. You're writing to the director of health department and the purpose is to notify the potential primary contacts. Berna says that need not include medications and date by history. No, that's told by Prajesh, sorry. Now, Berna says that other medical conditions and treatment provided in isolation ward are irrelevant. Yes, because that doesn't come under the health department's concern. The health department is concerned about notifying the primary contacts mostly. Management include negative pressure isolation room with airborne precautions, right, Najar? Neetu says GERD is not important. Okay, that's also not may not be important. We'll have a look. We'll be showing that on the screen. Olachi, this should be an information type of letter, says Chioma. Yeah, that's right, Chioma. You have identified the correct type of letter. Yeah, Prajesh says that no need to include all the management done from hospital. Yeah, you don't have to include the details. You can just write in a very concise manner how you have managed. So your time is about to end, and then we'll have a look at the answers. Most of your answers might be correct, some might be wrong, or majority of the most part of your answers might be right. We'll just double check with our answers here on the screen. Okay, so the time is up. We'll have a look at the answers. So I have here marked in red and green. What are the relevant information? Sorry. Let's include the green ones are the relevant information, and I have marked the recommendations in blue. So I've marked all the relevant informations in green. We have selected it in green, and the recommendations are in blue. You can check this with your answers. Yeah, Maria Pinto. Initial progress of symptoms, isolation, progressive symptoms, treatment, contact of district health nurse, temperature, throat swab taken, managed with analgesics and antibiotics. So let's have a look. What have I selected? Apart from the analyze part we already have selected, that is definitely relevant. Apart from that, you need to include that he was screened at temperature checked at airport, findings are unremarkable, strict isolation at home, district health nurse to be contacted in case of any symptoms, emergency number was given. You can see that I have avoided his over-the-counter drugs and all those things. I also avoided that he was feeling bored and lethargic and no other symptoms on 23rd. I didn't include that. But I have included that he has slight sore throat and mild fever, and after taking paracetamol, it did not subside, but it worsened, and he contacted the district health nurse, and he was transported via ambulance to the Prince Charles Hospital, Melbourne, and he was admitted into the isolation ward. His temperature was 38 degrees. His throat swab was taken and it was sent for SARS-CoV-2 PCR. He was started on analgesics and antipyretics. He had difficulty in breathing, so chest X-ray was taken and he had ground glass appearance of both lungs. So our assessment was bilateral pneumonia and PCR test positive. Diagnosis was COVID-19 with bilateral pneumonia, continue negative pressure isolation room, supplemental oxygen, start hydrochloroquine, etc. Place the patient in airborne precautions, place the barrier nursing precaution board, avoid aerosol generating procedure, transfer to COVID-19. But this of these are the relevant information, but the recommendations are different. I have given it in blue. The other things you can inform in a concise manner. The recommendations, that is a thing to be done by the healthcare department. The director of health department is given in blue, that is to notify the primary contacts and to screen the contacts. They can also add about advising the family not to visit. So it will be a joint thing by you and them. And also you can include about chemoprophylaxis for the family. These three would be the recommendations, the thing that is to be done by the health department. So again, this is an area where some people have difficulty, and though they find out the relevant information, sometimes there is a problem in writing. Like you just have to, if you just have to inform, just say that this patient has been started on this. You don't have to say, please do this or please do that. That is why I have put the relevant information in one color and the recommendation in different color. Only the recommendations are to be done by the recipient. Other things can be conveyed, but those are not the things to be done by the recipient. So if you want to, you can take a screenshot of the same. So there are certain questions here. Simi Jo says, please mention why we want to mention chest x-ray. You don't have to mention. Those are the relevant things. We will change it. These are the relevant information. But in our next step, that is in transformation, when we transform it, we will reduce the unwanted details. We will just make it short. You don't have to include all those things. These are the important things, but you will transform it. You will make it concise. So once I hope everyone have selected the information, now let's go to the next step. Next step is all about transforming. So just selecting and just copying the same information from your case note and pasting it onto your answer sheet won't help you pass OET, because OET is basically and fundamentally, it is a language test. They are testing your language. You have to analyze, you have to select. But once you do the selection, you should be able to write it in your own words. So transformation means writing in your own words. Keep a list of the selected information, and when you write, change the form, put it in your own words. So these are certain techniques which you can use to transform the selected information. The techniques are to paraphrase. Paraphrase means nothing but to put it in your own words. If the case note says the patient fell down, you can say the patient had a fall instead of writing the patient fell down. So put it in your own words. Summarizing. Summarizing is what exactly I told you now, Simi, that the information about taking the swab, giving the sample, getting it as SARS positive, and taking X-ray, seeing it as ground glass appearance, and identifying pneumonia, all these has been summarized. We will summarize it. Those are the things that you look at and you identify that these are the patient's problem. But we will transform it in the summarizing area. Next is reorder. In the reorder, we may not write the information in the same order as in the case notes. We might put it in different order. Another way is like we may not include all the details. We may not include all the step-by-step visits. In this case note also, you might have seen that the patient has, there are multiple dates with the patient's symptoms. We won't write all those things. Then the other method is to change the word form. So suppose the word given in the case note is reduce, which is verb. I would change it to reduction. Change the verb to noun, or vice versa also. So these are the 4 techniques wherein we will transform the selected information. Once you select, you have to do this. You cannot just copy paste from the case note and write it on the letter on the answer sheet. Transformation is very, very important. Only then will you pass the test. So 4 techniques are paraphrase, summarize, reorder, and changing the form. I hope that answers your question, Simi. So once we saw how to transform, now let's go to our next activity. So first thing now you have to do is to write an appropriate introduction. And when you are writing an introduction, what you have to understand is that that introduction should be appropriate for the recipient. And it should include the purpose of writing and the main issue. So when you're writing the letter, I told that it should be appropriate. So it depends on a lot of things. It also looks at whether that recipient is a lay person or a medical person, etc. So make sure that whatever you write is appropriate for that recipient and try to personalize, try to individualize it. Don't just write ready-made introductions. Don't do that. You have to write a letter in such a way that that is specific for that patient and for that recipient and for that purpose. So now we will be writing an introduction for this particular task, and in that make sure that you are writing it in a way which is appropriate for the recipient, and it should include the purpose of writing and the main issue. So here I have this task in front of me. We have selected the information and everything. So I'll give you 5 minutes. You just have to write a beautiful introduction which includes the main issue as well as the purpose, and it is appropriate for the recipient. So our time starts now. You can type your introduction in the live chat here. So be ready with your pen and paper, and please type on the live chat what your introduction is. You can write the same introduction as you wrote in your letter, or you can type in a new introduction, including the purpose and the main issue. Yeah, I can see many introductions coming in. So Limia is the first one to send the introduction. Mr. Adam Smith was diagnosed with COVID-19 with bilateral pneumonia. His primary contacts require screening and education. Not bad, but was is not right. He's still diagnosed. So you can change the tense form, and you can also start as a better introduction. I mean, the starting can be better. So Prajesh and Josmi, Josmi writes that I'm writing to notify the primary contact of Mr. Smith. No, you're not writing to notify. You're writing to request to notify. So Prajesh says this letter is to introduce Mr. Smith to notify his Manju Alex, I'm writing to request you to identify the potential contacts of Mr. Smith as he has diagnosed with COVID-19 and bilateral pneumonia. Somewhat right, but some problem in tense there. As he has diagnosed will be incorrect. It should be he has been diagnosed. Edith Rogers says, Okay, it's the earlier thing of the relevant information. So we are looking at the introduction now. The purpose of this letter is to request to notify and screen the primary contacts of Mr. Smith, who recently has been diagnosed with COVID-19. He is in isolation ward now. Okay. Naja Ajayan, I'm writing to provide information about Mr. Smith, who has been diagnosed with COVID-19. Oh my God, it went up, sorry. So Asenwa Nikam says Mr. Adam Smith was diagnosed with COVID-19 with bilateral pneumonia. There is need to notify his primary contact for screening. Issue and purpose is there, but you can put it in better words. Akil Matthew, I'm writing to request your good self to find out primary contacts of Mr. Smith, who has been diagnosed as COVID-19 with bilateral lobar pneumonia. Actually, you don't have to write good self. That would be slightly overboard. You are writing an occupational letter. So don't write such fancy words. Jitu Joy says, I'm writing to introduce Mr. Smith, who has been under our care for the treatment of COVID-19. Kindly notify his primary contacts and needs screening for prevention of infection. Not bad. A little bit, instead of writing and need screening, you can just write and screening for prevention. No need of need there. Mary Vibinu, I'm writing with regard to Mr. Smith, who is diagnosed to have COVID-19 and bilateral lobar pneumonia, requesting you to kindly notify his primary contacts for screening. Okay, and Maria Pinto, I'm writing to identify the potential primary contacts with Mr. Adam Smith. It will not be with, it will be of Adam Smith, who has been diagnosed with COVID-19 with bilateral lobar pneumonia. So that preposition has to be changed, otherwise the introduction is good. So yeah, the time is up, and I'll read one or two more of introductions, and then we'll compare with one of the introduction that I have written here. So Swati Rai, I'm writing to introduce Mr. Smith, who has been diagnosed for COVID-19. Sorry, it scrolled up. Chioma says, I'm writing to inform you about Mr. Adam Smith, who was admitted into Prince Charles Hospital isolation ward, diagnosed with COVID-19 bilateral pneumonia 5 days after his return from Italy. So the main issue is included there, Chioma, but the purpose is not there. So you have to include the purpose as well. Now we'll just have a look at one of a sample introduction that is written by us. Compare it with yours. So you can see here on the screen. So I want to tell you that there's nothing like only one way to write an introduction. Or many of your introductions are very beautiful and has all the purpose as well as the main issue. There are multiple ways to write an introduction. Here I'm showing one way to write the introduction. So try to be original. Try to write in a very personalized way. That will give you more originality, will give you more scores if it is correct. So I'm writing to request your service to notify and screen the primary contacts of Mr. Smith, an architect who returned from Italy on 23/3/2020, as he has been confirmed to be positive for COVID-19. So you can write, this is one introduction. We have a few more introductions coming up. If you want to, you can take a shot of this screenshot or snap of this introduction. Susamma Rajan, I'm writing to request identification and screening of primary contacts of Mr. Smith, who has been diagnosed with COVID-19 with bilateral pneumonia. Okay, that's good. Atira Sachu, I'm writing to inform regarding Mr. Adam Smith, who is diagnosed with COVID-19. Jubin Abraham Ambatu, I'm writing to request you to notify the primary contacts of Mr. Smith, who has been diagnosed with COVID-19. Good. So all these are good. So what I want to tell you is that you don't have to always follow a particular format, as long as your language is correct and your main purpose and the main issue is there in your introduction, and it has the appropriate level of politeness and everything, then your introduction would serve the purpose. So you can have a look at the introduction there on the screen. So since we have done with the introduction, we'll go to the next thing. We won't be writing the entire letter today because that would take a lot of time. So since we have written the introduction, now we'll try to write the request paragraph. Again, for the request paragraph, you should make sure that it is appropriate for the recipient and it should include the recommendations, that is, the specific details of the actions to be undertaken by the recipient. And in today's task, I think that is where many of you had gone wrong when I gone through the letters posted in our group. So now it's time to write the request paragraph, the recommendations. Include the things that are to be undertaken by the recipient. So here it is. I have shown you the task card again, and we will start the timer now. So there's a question by Olachi that must you include a social history in your introduction? That depends upon the purpose. If it is important, you can add. So I have included the travel history because it's related to the COVID, possibly related to the COVID. So you can include. There is no rule that it should be included or it should not be included. If your purpose is related to a social thing, you can include. It all depends upon the purpose and the recipient. Okay, I wrote an architect because it's again not there is no rule that you should include it only in the social history. I included as a traveler or as a person who have come from Italy. So there is no rule like you should include his profession only in the social history. You can also omit it from the body of the letter. If you want, you can write that part in the reference line. For example, in the reference line, you can write Mr. Adam Smith slash a 58-year-old architect. So there is no rule like you should include this information only in this particular paragraph. So a few more introductions coming up. Musi Grau, I hope I pronounced your name correctly. If not, I'm so sorry. Mr. Smith Adams, an architect, is recently diagnosed of COVID-19. I'm writing to request for contact tracing of all his primary contacts. Good, but you can put it in the reverse order. That will be more appropriate, more beautiful, much more beautiful. So you all can start writing your conclusion paragraph or the request paragraph, including the recommendations to the director. What are the things the director should do for this particular patient? So, Abarna Pappu, it would be greatly appreciated if you could notify the health authorities and primary contact, not primary contact, it will be primary contacts, plural, of Mr. Smith. His family will require chemoprophylaxis. Please note, family will not be allowed to visit. Yeah, but that tone is a bit, can be a little bit smoothened instead of not saying will not be allowed. You can put it in better words, but you have included most of it. Bandana Devi. As mentioned, as above mentioned circumstances remains unchanged, it would be greatly appreciated if you could assess and examine Mr. Smith and screen his primary contacts. Well, Bandana Devi, there is a mistake there because the district health department's or the health department's director is not going to assess Mr. Screen. He will just identify and screen the primary contacts. Ansi Mariam Abraham. I am writing to request you to notify and screen the primary contacts of Mr. Adam Smith, who has been diagnosed with COVID-19 and pneumonia. Okay. Yes, Mary Vipinu, you have changed it to primary contacts, correct? Maria Pinto, in view of the above, you're requested to continue Mr. Adam Smith in negative pressure isolation room along with oxygen and airborne precautions as a treatment to begin hydrochloroquine. Now here, Maria, you went wrong because you're writing to the director of the health department and his purpose was to notify the potential primary contacts. The patient is still with you. So you are the one who will be continuing to provide the isolation room, oxygen, airborne precautions, etc. The reader doesn't have to do that. So you can rewrite your request paragraph. Anjali NS. It would be greatly appreciated if you could take steps to screen primary contacts of Mr. Smith. Okay. Simi P. Joseph. Kindly inform health authorities and his potential. It went up. I don't know why I'm not able to do that. Akil Matthew. Simi, can you just type your introduction one, conclusion letter, paragraph once more? Akil Matthew, under the above, yeah, I got it, sorry. Kindly inform health authorities and its potential primary contacts and to perform screening of process those involved. I think you may have to correct that paragraph. Under the above circumstances, it would be greatly appreciated if you could find out his primary contacts. It is essential to notify and screening for them will not be right. Screen them. So Danny Varghese, it would be greatly appreciated if you could arrange supplemental oxygen and ask to continue a negative pressure isolation room. Please start hydroxychloroquine for him as treatment. Again, Danny, as I told just a while back, the director is not going to look at those. He'll be just screening and notifying the primary contacts. Precious Akinbi. In view of the above, it is paramount important to notify Adam's potential primary contacts of this tragedy and for possible screening. Now, Precious Akinbi, paramount to notify is enough. No need of paramount important. Then do not include judgmental word like tragedy or etc. or personal feelings. Avoid such language. Susan Maharajan, it would be appreciated if you could track the primary contacts and screen them. Kindly note his family will be considered for chemoprophylaxis and advice is needed to restrict the visit to the patient. Okay. Naja Ajayan, I am writing to provide information about Mr. Smith who has been diagnosed with COVID-19 with bilateral pneumonia. Please identify his primary contacts who require screening. So I think that is the introduction. Minu Joseph, kindly scrutinizing Mr. Smith's primary contacts and please provide education regarding preventive measures. It is important to initiate chemoprophylaxis to his family. Education regarding preventive measures is not included in the case note, so don't include that. So let's have a look at the introduction. So the time is up, and let's have wait for one or two more conclusions of the request paragraph, and then we'll move forward to see up a sample request paragraph. Again, there is no one way. There are many ways to write the request. We'll just be showing one of the technique of writing the recommendation. So Prajesh PK, in this regards, kindly instruct his family to avoid visiting the hospital. Please notify the primary contacts of Mr. Smith and a screening of the contacts need to be conducted. Good, Prajesh. Swati Rai, pertaining to the above, kindly provide chemoprophylaxis to Mr. Smith family and explain risks involved in hospital visits. Also identify and screen the potential person contacted. That can be again rearranged a little bit because the main purpose is to identify and notify and screen the primary contacts. So Manju LX says that it would be immensely valued if you could evaluate and screen the close contacts of Mr. Smith. Currently has been continued in isolation room with supplemental oxygen and airborne precautions. Good. Naja Ajayan, it would be greatly appreciated if you could identify Mr. Smith apostrophe S primary contacts who require screening. Please advise the family not to visit him and start chemoprophylaxis therapy. In view of the above, it would be yes, Maria, it is better now. In view of the above, you are requested to recommend chemoprophylaxis for his family, also restrict family visits. It is vital to notify health authorities and screen primary contacts of Mr. Smith. Simi P. Joseph, if it would be better will not be a good language. It would sound a little bit like a threat. So you can say, kindly inform. It would be good. It would be beneficial if you could make arrangements to notify and screening, notify and screen, not screening, notify and screen primary contacts of Mr. Smith. His family members need to be provided with chemoprophylaxis. And Simi P. Joseph, kindly inform health authorities and his primary contacts and perform the screening process of those involved. Please consider the need for chemoprophylaxis to his family. Not bad. So the ones we will have a look at one of our sample request paragraph. You can compare it with yours. So here it is. It's not much different from yours. So it would be appreciated if you notify the primary contacts and provide SARS-CoV-2 screening for them. The family is advised not to visit the patient, and hydroxychloroquine chemoprophylaxis can be considered for them. So this is one way of writing the request. So let's see, there are more request paragraphs coming in. If you want to, you can take a screenshot or a photo of this request paragraph. So we have seen how to transform. So you can see that I have not used any particular template for the introduction or for the conclusion. What I have included the patient's main issue as well as the purpose in the introduction. And also I have included the main things that the reader should do for the patient or the patient's contacts or whatever. That is what our request to the recipient is. That has been included in the recommendation. So there is no particular way of writing. There is nothing like you should use this particular word or this particular kind of sentence for introduction or for the request paragraph. Try to be original, but original doesn't mean that you have to be different from others. Just being different from others won't give you any special marks. It should be appropriate for that recipient, for that purpose, for that main issue. So this was actually a step-by-step teaching class. As we promised, we'll be giving you writing correction of the letters that you have already submitted to us. So don't be sad if I didn't go through all the introductions given here. I'll try to include as many possible corrections for all the comments here, all the live chat here. But your letters will be corrected as promised. So this is not a writing correction session. This was the step-by-step live class on how to analyze, how to select, and how to transform. So we have written the introduction as well as the request of the request paragraph. Let's have a look at the entire letter. I'll show you a sample letter for this task. So this is a sample letter. You can take a screenshot of it if you want to, and you can compare it with your letter. Again, let me say that there is no one particular way of writing this letter. This is just one way of it. So if you want to, you can just take a screenshot or a snap or photograph of this sample letter. We shall also send it to you on the Telegram group. And I want to tell you one more thing. At the end of this session, please type in your email ID in the live chat so that we can send you a sample letter, as well as we'll send you a format of 3 different structures which can be used for any writing task. So if you type in your email ID, which you access easily, type those email IDs in the live chat. We'll send you the sample letter as well as Odin's format for letters. Again, it doesn't have any template or any specific sentences, but that format will have 3 different structures which can be used for any kind of task that you come across. So this is the sample letter. Type in your mail ID so that we can send it to you. So this was today's live session on step-by-step writing of a particular task. We couldn't do the main, the treatment part, but we can have a live correction on it soon. I'll also give you correction on our Telegram group. So till now, about the analysis, about the selection and the transformation, and about the introduction and the conclusion or the request paragraph. If you have any questions, please type it now. We'll answer it now. And please don't forget to subscribe to our YouTube channel because only if you subscribe, you'll be notified about all the live sessions and all the recorded sessions that we will be posting and publishing on YouTube. So subscribe now, just press the red button and also press the bell icon so that you'll be notified every time we conduct a live session or we publish a new video. Our YouTube channel is Odin English. Any questions regarding the step-by-step technique of analyze, select, transform? Then there are 2 more steps, that is review and amend. If you have any questions, you may type it in the live chat now. Yes, Asan Vankam, we'll definitely share the sample letter. And also please type in your email ID so that we can send you the format, the Odin's format, which will help you in selecting the different structures to write any kind of OET's writing task. So Susama Rajan, instead of architect, we write frequent traveler. You can add that because it's not about instead of architect, you can add frequent traveler. Actually, I have written that in the social part. So you can write instead of architect, yes, you can add frequent traveler like Mr. Smith, a frequent traveler who's written from Italy can be written. So Alachi, after the request paragraph, no, you don't need. Actually, you don't have to write the request at the end always. So that's why I told you we'll give you a format. If you just type in your mail ID in the live chat, we'll send you a format because there are 3 different structures that we usually follow. One is based on the priority. Second is based on chronology. And the third is based on problem and solution. So it's not that you always write the recommendation in the last. In certain things, there are other ways, other structures also. So we'll give you that template. Just type in your email ID in the live chat. So Sean has a question whether we can use the same word in the intro and recommend, that is notify. Well, Sean, what I have done is that I have changed the notify to notification. So you can change the form. You can use, but it's better that no need of asking, no need of repeating it. It's better to change, but you can repeat at certain times. So, Naja, what was your question? Can you just add your question once more, Naja? Simi P. Joseph has a question. I doubt that if the writing task appears on behalf, whether we need to mention on behalf. Yes, it's better to include behalf in the introduction because that is a request made by someone else. So you can clearly convey that to the reader that this is a request of someone else. It's not compulsory again, but that will clearly be conveyed to the reader that that is not your thought, that is someone else's thought. So Asha Vijayan has a question like how we know that advice already given. It's given in management plan. So again, Asha, it's not that it is already given. So the thing about certain things, you have to look whether it is your management plan or it is to be done by the reader. It can be shown as a management plan or it can be shown as the discharge plan. So all the things by which are there in the discharge plan may not have to be done by the recipient. It might be your plan. It might be done by you. You might be the person who will be doing it, or it might be some other person. So you have to first identify whether it is by you or by the reader. And accordingly, depending upon the tense form used in the case note, you can understand whether it has already been done or it is to be done. The tense form will show if it is in the past form, that means it is already done. If it's not in the past form, then maybe it is to be done. Josme Jos, family advice done by writer or should be done by recipient? It can be done by both actually. Manju Alex has a doubt whether we need to add regarding isolation and airborne precautions in the request part. Well, Manju, you don't have to because the patient is still with you. The airborne precaution and the isolation is for the patient. The patient is not discharged. You are the district, the director of the health department is going to notify the primary contacts. So you don't have to tell about the airborne precautions. You can include that in somewhere in the letter that this has been started for the patient. You don't have to write it as the recommendation because that is not what the reader will do. Now, Precious Akimpi has a doubt. Well, Precious, 58 years, you can write 58 years. And when you're writing 58 years old, That's also not wrong. And another way to write is you can make that an adjective. For example, 58 hyphen year hyphen old, and then put a noun, that is architect or frequent traveler, that is 58-year-old frequent traveler. So if you hyphenate it, it will become an adjective, and in that case you'll have to always put one noun in after it. Well, we have Alex here, and thank you, Alex, for the recommendations. Thanks a lot. So Naja Ajayan, family's advice, whether advice had already been given or not, or it's the responsibility of the director to give advice. So that is something which is done by you, as well as it can be done by the director also. Shan asks that in case they given a specific purpose to request to director, then why we request regarding prophylaxis and visit to the director? You don't have to request that, you can just mention that. So I think most of the questions are over now. So again, I would like to remind you, if you need that Odin's writing format, please type in your email ID in the live chat. We'll have a look at it and we'll be sending it to you soon. So Nancy Tony has a question, how to give introduction to refer back letters. Yes, we'll be selecting different kind of letters and we'll be showing you how to write an introduction for those kind of letters as well. And once you have typed your email ID, you can also add like what kind of sessions would you like to have in the future from us. It can be about writing, or you can also tell us like what are the other modules and what are the problems that you face in the other modules, that is reading, listening, and speaking as well. So it need not be limited only to the writing. You can please type in the live chat of what are the different sessions that you expect from us, which would help us to identify your needs and give you sessions accordingly. Olachi, thank you. Definitely, you will be able to clear this time. Just make sure that you use the techniques correctly and don't be in a rush to write your letter. Prepare well and take the test only when you feel confident enough to take the test. So Manju Alex has a doubt whether I can mention regarding isolation and airborne precautions in the conclusion part, or else where should I include that? You can include that in the management part. That is, we have today in this introduction, in the letter also, I have included it in the management part. So you can include that in the management part as well. So CG, yes, you can send us a message on our Telegram number, or you can, I'll show you our mail ID. You can send your detail or request to our mail ID, or you can just text us on Telegram. We'll give you the details of Premium Write Smart. So Manju Sebastian needs more tips on speaking. Yes, we'll be having a session on speaking as well soon. Tenses is an issue. Okay. Tips to organize letter. So Shan, the thing is that we have been having a little bit of restrictions in our area. So we couldn't have much of our HR, human resources and staff. So we'll be answering you. Please text me on my number. I'll be replying you surely. Or you can just type in your email ID in the live chat. We'll be giving you all the details in your mail ID. So yeah, many people have problem with reading and listening, especially the C part. C part of reading is kind of a nightmare for most of the people. Yes, we'll be having sessions on that as well, and speaking sessions. Sure. I hope you all have started doing your speaking with your partners. We had with all your requests and to help you started the Speaking Partner Initiative, which is a free service by Odin English. And please do practice speaking with your partner. And if you get a time, you can practice with other partners as well. So if you practice it with more than one person, then you have better chances to succeed in the test because you will be getting more skills, more techniques from more people. So please utilize our tech initiative. Uh, we have given, we have took the name of around 100 participants and made 50 pairs. So there have been new names coming up. We'll be giving a list for those people as well. Yes, Siji Thomas, we do have course for OET speaking as well called OET Speak Smart. Yeah, so Sarma has a doubt about principal clause and subordinate clause. Definitely, we'll be having separate sessions on um, grammar. It may be live, or we would also put up certain recorded lessons as well. So, thank you for giving all your suggestions. We'll definitely compile these and come up with sessions for all those areas that you find difficulty in. Yes, Aparna, if you have problem with the flow, then the best thing to do for speaking is to practice. You might have the idea, but for the speaking, you should be in the habit of speaking English. So practice, 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 and practice with the right person. And if you have too much of problem, then better idea would be to enroll to a good course wherein you will get a correct feedback from a mentor. So that's all. Thank you for participating in today's live session on step-by-step writing. And for the details on our writing service as well as our speaking service, you can please type in your email ID, and you can also type in your email ID to get our writing format. Thank you, and please stay safe and take care of yourself. And I hope that this is a new year for most of us in India. So I hope that this will be a new start, and we will overcome all the difficulties, and all of you will witness great success this year, pass OET, and get placed in your dream career overseas. So thank you. We'll see you again soon. Have a great day.